COVID-19, a name that once brought the entire world to its knees, is returning. Not with sirens blaring. Not with rows of ambulances screaming through the streets. But with a terrifying silence. From small clinics in Shanghai, to overcrowded hospitals in Bangkok, and now quietly spreading across Singapore. New infections are steadily, dangerously, and silently rising once again. The virus doesn't knock. It waits for you to fall asleep. In China, the COVID-19 positivity rate among flu-like patients has doubled in just a few weeks, rising from 7.5% to 16.2%. Thailand has reported nearly 54,000 cases in just the first 4 months of 2025, with Bangkok alone hitting 14,000 in a single week. Singapore is on high alert, tracking 2 new variants, LF.7 and NB.1.8, both descendants of the strain that wreaked havoc in late 2023. Everything is repeating itself. But this time, humanity is no longer afraid. And that is what terrifies epidemiologists the most. Abhigya Anand, the Indian prodigy who shook the world by predicting the first COVID outbreak, issued this warning back in 2023. 2025 will mark the beginning of a new pandemic. It won't come like a storm, but like smoke. No one will notice, until there is no way out. Many dismissed his words. Wrote it off as just another baseless prophecy. Just internet mysticism. But now, as the epidemic map of Asia turns red once again. As new variants disguise themselves behind common cold symptoms. As masks are abandoned, vaccines forgotten. As we, ourselves, forget what lockdown ever felt like. We have to ask. Was it really superstition? Or was it a warning we refuse to hear? You can believe, or not. You can prepare, or keep laughing. But the truth is, the warning has returned. And this time, it doesn't need to scream. It only needs you to stay silent. Part 1, Current Signs in Asia, the return of COVID-19 and dangerous variants. It's no longer a theory. No longer a few scattered cases. The resurgence has begun, and once again, the epicenter is Asia. China. In recent weeks, China's healthcare system has been bracing itself against a surge of unusual respiratory illnesses. The COVID-19 positivity rate among flu-like patients has spiked from 7.5% to 16.2% in just over a month. It doubled. But the truly frightening part isn't the number. It's the reaction. No one is panicking. No one is putting their masks back on. No one is asking. Is this the first sign? The virus is returning. But this time, it doesn't need to bypass our immune systems. It only needs to slip past our indifference. Thailand. From January to mid-May 2025, Thailand has recorded 53,676 confirmed COVID-19 cases, including 16 deaths. Doesn't sound catastrophic? Then consider this. In the single week from April 27 to May 3, Bangkok alone reported over 14,300 cases. In 1 week. That's more than 2,000 infections per day, in a city that once declared it had herd immunity. The government calls it an endemic disease. The public calls it old news. But the virus doesn't need a name. It just needs you to leave the door open. Singapore. Singapore, once praised globally for its exceptional pandemic control, now faces a new wave it can no longer ignore. Cases rose from 11,100 to 14,200 in just 1 week. Hospital admissions reached 133. 2 new variants, LF.7 and NB.1.8, are now dominant. More alarmingly, these strains are direct descendants of JN.1, the variant that fueled global outbreaks in late 2023. Their shared traits: fast transmission, mild or no clear symptoms, partial resistance to existing vaccines. We once had time. We once had a window to act. But now, perhaps it is humanity, not the virus, that has evolved into something less alert than before. Asia is turning red. 3 countries. 3 different healthcare systems. 3 contrasting approaches. Yet all are showing the same trend. Rising case numbers. New variants emerging. A public that has let its guard down. Governments offering reassurance instead of warnings. If you piece these fragments together, what do you see? A seasonal wave? Or the rebirth of a new pandemic in disguise? Don't wait until hospital beds are full. Don't wait until masks are sold out again. And don't wait until the prophecy becomes tomorrow's headline. Because what is happening in Asia today could be the mirror for the rest of the world tomorrow. Part 2, New Variants, the virus's invisible mask. The virus is no longer a simple predator. It doesn't need to be aggressive to survive. It only needs to hide better than we can detect. LF.7 and NB.1.8, not designed to kill outright, but to feel harmless. These names are still unfamiliar to most. And yet, they are quietly dominating the variant landscape across many parts of Asia. They are direct descendants of JN.1, the strain that swept across the globe in late 2023. But this time, the evolution is far more cunning. LF.7 and NB.1.8 carry 3 traits that deeply concern epidemiologists. Rapid transmission in enclosed environments. Short incubation period, but vague, nonspecific symptoms. The ability to partially evade antibodies from earlier vaccines. What does this mean? It means you could be infected, and not even know it. You could pass it to your loved ones, without coughing once. And by the time you realize it, 5 or 6 others may already be part of the chain. The real threat isn't the virus, it's the belief that it's all over. A variant that causes high fever, pounding headaches, and difficulty breathing makes people cautious. But one that causes just a bit of fatigue, a runny nose, a mild sore throat, makes people drop their guard. And that misplaced confidence is the door the virus has been waiting for. A WHO expert once warned. The second pandemic, if it comes, will not be caused by a deadlier virus, but by a society that thinks there's nothing left to fear. Variants, or masks worn by something far deeper. No one flinches anymore when a virus changes its name. Alpha, Delta, Omicron, and now LF.7, NB.1.8. But stop and ask yourself. Why does the virus keep evolving, while we do not? Why, after millions of lives lost, have we still abandoned simple habits, like hand-washing or wearing masks in crowded places? Could it be that the virus is just a mirror? A reflection of our exhaustion, and our apathy? And if what Indian prophet Abhigya Anand once said is true, it is not the virus that will end humanity. Humanity will unplug its belief in warnings, and collapse under its own pride. Then perhaps LF.7 and NB.1.8 are not just variants. They are biological warnings. Masks of time, bought for us to act before the next wave becomes irreversible. The next pandemic won't need a name. It may not be called COVID. It won't need a frightening new variant code. It won't even need a death toll splashed across headlines. All it needs is a world too used to, it's fine. A society that has lost its survival reflexes. A public that considers pandemics a thing of the past, and believes itself immune to the future. And that is the real catastrophe. Part 3, Bridging Prophecy and Reality. Is this the foretold catastrophe? History doesn't repeat. It echoes. And only those who are truly awake can hear that echo. Beneath the noise of everyday life. We live in an era of data, science, and artificial intelligence. And yet, amidst a world that seems to have explained everything, there are ancient texts, forgotten voices, and dust-covered manuscripts. That once spoke of events terrifyingly close to what we're witnessing today. Abhigya Anand, the prophecy from a boy no one took seriously. In 2023, during a widely debated talk, Indian prodigy and prophet Abhigya Anand, who had previously predicted the 2020 pandemic, warned. The next pandemic will emerge in mid-2025. It won't arrive with panic or chaos, but silently. Woven into the routines of daily life. And that is precisely why people won't see it coming. At the time, many laughed. Media dismissed it as clickbait. But now, look at the outbreak map of Asia. China, positivity rate doubled in just 5 weeks. Thailand, nearly 54,000 cases, with a peak week in Bangkok. Singapore, LF.7 and NB.1.8 silently spreading. New variants, not causing mass fatalities, but evading community immunity. Each puzzle piece fits perfectly into Anand's chilling forecast. Declassified documents and the forgotten biological cycles. In the United States, leaked files from the CIA reading room described a strategic simulation codenamed Biological Resonance, Phase 2. It predicted a recombinant viral strain will emerge from Asia in 2025. It won't kill en masse but will crash medical response systems through rapid spread and vague symptoms. Average reaction time will exceed 18 days, enough for the virus to infiltrate supply chains, urban infrastructure, and social systems. As simulations begin to mirror reality, we must ask, was this just predicted, or was it already known? Ancient Western Astrology, 2025, the triple eclipse of human civilization. Many Western astrologers refer to 2025 as the year humanity reaches the bottom of its cycle. Why? Because 3 ominous alignments converge. Pluto returns to Aquarius for the first time in 248 years, historically linked to the collapse of old societal systems. A total solar eclipse, symbolizing the shadow that blinds reason. A conjunction of Saturn and Neptune, a period when humanity falls for illusions of safety. All in the same year. All while new variants spread. All while trust in science, in healthcare, in warning systems, begins to fracture. Could it be that the virus hasn't come alone? But with it, the climax of a cycle, where rationality and survival instinct fall out of sync. Ancient signs, from scripture to sacred texts. In the book of Revelation, there is a haunting line. And the beast shall return, not with claws or roar, but with an invisible breath that chills the hearts of men. In the Rig Veda, a 3,000-year-old Indian scripture, we find this. A colorless wind shall rise from the east, not killing swiftly, but draining the vitality of society, day by day. Centuries ago, no one understood these words. But in a post-COVID world, they no longer read like religious poetry. They feel like news bulletins disguised as prophecy. So, where are we in this ancient warning? Has the virus returned? Is it spreading from Asia? Are symptoms vague or unnoticeable? Is the public unprepared? Are authorities reacting too slowly? Have people become numb because we've seen this before? Then this is no longer a possible warning. It is an unfolding event. The final question is no longer, will it happen? But rather, how much time do we have left, before it can no longer be stopped? Part 4, the alarm bell, what awaits if we stay complacent? There will be no explosion. No sudden lockdown orders. No blazing red alerts from global health security systems. Instead, it begins with a mild cough in the middle of May. A crowded meeting where no one thinks masks are necessary anymore. A short holiday flight, with no testing required. A quiet news headline, buried beneath celebrity gossip and market chaos. And then, it begins. If we continue believing it's already over. Look back at history. The 1918 pandemic didn't end with medicine. It ended with exhaustion. SARS was stopped not by vaccines, but by swift, unified action. COVID-19 in 2020 became a global disaster because of the delay, the hesitation to react. So what happens if 2025 follows the same pattern? But this time, we've lost our vigilance. We're no longer willing to distance. No longer patient enough to listen. No longer ready to sacrifice anything for the collective good. The scariest scenario isn't mass death, it's quiet collapse. Hospitals flooded with mild cases, still needing attention. Doctors and nurses falling ill in droves, with no one to replace them. Supply chains slowing down, as workers call in sick across sectors. Schools and businesses closing in waves, though no one dares to call it lockdown. Governments afraid to take decisive action, because economies haven't recovered yet. And so, the world enters a pandemic-like state. But no one calls it a pandemic anymore. No global campaigns. No united slogans. Only individuals, cities, nations, struggling quietly on their own. When a warning is repeated too many times, we stop believing it. It's a psychological truth. Hear the fire alarm too often, and people stop evacuating. And when the real fire comes, no one leaves the building. Likewise, we've heard the virus is back too many times. We've heard about new variants too many times. We've heard get your booster too many times. And now, we've fallen into the trap of repetition. It's probably fine. This will pass, just like before. But what if this time, it doesn't? The real danger isn't the virus, it's a world that's gotten too comfortable with risk. A society that once had strong defense reflexes has now lost them completely. No masks. No sanitizers. No updates on public health. No concern about case numbers, because we've heard it all before. A world once willing to stop everything for public health now only thinks about deadlines, profit margins, and social metrics. If this time, the pandemic returns. But no one dares to call it a pandemic. When will we finally realize, we're already sinking? What remains, if we continue to dismiss the warning? It won't be the first patients who suffer, but their loved ones. It won't be a global shutdown, but a nameless fear spreading everywhere. It won't be a war between humans and a virus, but a war between memory and denial. And when the alarm bell rings one last time, there may be no one left who turns back. Because by then, everyone will believe that sound wasn't meant for them. Part 5, The Pandemic, a Warning. Or a sentence repeated. The first time, it came as a shock. The second time, it came as a shadow. And if there is a third time, it will arrive as a part of the life we chose to live. We can invoke science, analyze data, study history, and even compare it with prophecy. But the deepest question of all doesn't lie in graphs or numbers. It lives in the conscience of each person. What did we truly learn the last time? Is the pandemic a threat, or a mirror? A mirror that shows just how vulnerable our societies really are. How quickly we forget. And what happens when warnings are dismissed too easily? If we see it as a reminder, then we still have time. Time to prepare again. Time to rebuild vigilance. Time to preserve the small things humanity learned in the middle of so much pain. But if we continue to treat it as a nightmare that has passed, it will return. As a sentence. A sentence with no formal declaration. Because our own complacency will sign it for us. This story doesn't end with the virus. It ends with how we, as a species, respond to repetition. We can reject the prophecy. But we can't reject the reality. We can grow tired of warnings. But we cannot afford to grow tired of survival. And if you're still watching this video, all the way to the end, then ask yourself this. Do you want to live in a world that learns its lesson? Or one that keeps relearning it through blood and tears? Because pandemics don't ask whether you believe. They only ask. This time, are you ready?